Mr. President.
The senator from Indiana.
Mr. President, I rise today to talk about the bipartisan Comprehensive Addiction and Recovery Act and the opioid abuse and heroin use epidemics. As I have said, I believe it will take all of us working together to address this public health crisis that is gripping Hoosier families and communities across Indiana and our country. We all have a role to play to address these epidemics. Officials at the federal levels, prescribers, pharmacists, law enforcement and first responders, and parents and families. This bipartisan CARA would provide states and local communities with important tools to prevent and treat drug addiction and support individuals in recovery. It includes several provisions adapted from my bipartisan legislation that would enhance prescribing practices and raise public awareness. We were also successful in getting a provision included that would encourage first responder units to connect individuals who receive naloxone with treatment or other necessary services. This bill includes programs that will make a difference and should be enacted into law. It is also critically important we fund these initiatives. CARA is an important step, but make no mistake, there is work left to do to ensure that our communities have the resources and funding to implement many of these important programs. We have a chance to do something meaningful and bipartisan that will help save lives. For every family and community in Indiana and across the nation that has been devastated by opioid abuse and heroin use epidemics, we must get legislation to the President to be signed into law. I also want to talk about another issue that is important to Hoosiers. Later today, the Senate will vote in favor of final passage on a bill requiring the labeling of foods that contain genetically engineered materials. I've worked with colleagues for months on this issue. I know this is about much more than just words or symbols on a label. It's about ensuring we have confidence in the food we eat and the food we feed our children. As a Hoosier, I also know this bill is about preserving a long and proud Indiana tradition of growing the food that feeds our communities and provides a safe and reliable food supply for the world. The labeling legislation before us is the result of us working together as Republicans and Democrats to achieve our shared objectives to provide consumers with access to accurate information about the food we eat, and to do so in a way that does not mislead consumers into thinking their food is not safe. When this bill is enacted into law for the first time ever, consumers across our country will have access to the information they want, and it will be easy to find. That information will also be delivered in a way that is fair, objective, and based in sound science. Today, I ask my colleagues to join me in supporting this bill for final passage, not because everyone got everything they wanted, but because it's a good compromise that achieves our shared objectives. Labeling genetically engineered materials will be required, so consumers everywhere will have access to the information. It will provide fair and objective information without stigmatizing foods that are completely safe. It contains provisions based on an amendment that my good friend Senator Carper from Delaware and I introduced, which will require clear and direct access to information on bioengineering through multiple methods of disclosure. Consumers, farmers, and food producers have been looking to the Senate for leadership. After months of discussion, we have found a sensible proposal that will bring the right information into our homes and to grocery stores in a responsible way. Mr. President, I yield back.